Well, mindfulness has its roots in ancient Eastern practices, but mindfulness as we know it today originated in the 1970s when a scientist, Jon Kabat-Zinn, piloted a new approach to helping patients who were suffering from chronic pain. Mindfulness-based stress reduction, or MBSR as it's known, reduced the pain substantially for patients that doctors had previously been completely unable to help. Jon's work became the focus for many scientific studies. In the 90s, Professor Mark Williams and colleagues blended MBSR with cognitive behavioural therapy to form MBCT, mindfulness-based cognitive therapy, to help patients with depression. MBCT helps people work more effectively with their thoughts, recognising them and choosing how to respond to them rather than reacting to them on autopilot. You know, as humans, we tend to spend very little time in the present moment. To use Mark Williams' words, our attention is hijacked by our thoughts and emotions, by our concerns, by our worries for the future, and our regrets and memories for the past. Mindful awareness is about learning to pay attention in the present moment and without judgment. It's like training a muscle, training attention to where you want it to be, and this reduces our tendency to work on autopilot, allowing us to choose how we respond and react. So in a nutshell, mindfulness progressively teaches you to become more aware of your thoughts, emotions and bodily responses such as tension. I like to think of it as brain training. It's rather like training a muscle, training attention to where you want it to be. And this reduces our tendency to default back to old mental programming, which may not be helpful.